name is Sara Knauft. I'm a developmental behavioral pediatrician fellow, and I'm going to be talking about my fellowship project, which I started this year, and we'll be continuing to work on it for the next 2 years of my fellowship. Here's our first slide. So I wanted to start my presentation by talking about a few background topics that I think are foundational to understand what my project is. The first thing is, what is a developmental behavioral pediatrician? This is a division within pediatrics that's a fellowship, and it focuses on taking care of children with developmental delays and differences in their development. They focus on things like autism, ADHD, intellectual disability, and developmental delays. And a lot of people haven't heard of this specific type of pediatrician because there aren't a lot of us. There are only 717 in the entire country that are board certified. And it varies a lot in the part of the country that you're in, what city that you're in, if they have one of these types of providers. And in some states, developmental behavioral pediatricians are one of the only providers that can make a formal autism diagnosis. So there's state to state variety, and in some states there's very few of them. And so there's a lot of bottlenecks in various states in regards to access to care for children that need developmental evaluations. So this is a map of the United States, and this map shows various different colors with a darker blue color, meaning that there are more developmental behavioral pediatricians per 100,000 children, and white means that there's zero. So there are states in the United States where there's no DBPs, and then other states where there are many. And the dots are fellowship programs. So there's a dot in Sacramento, and the guy down at the bottom will tell you a little bit more information about how many fellows there are there, but you can see generally a state that has a fellowship program has more DBPs, but there's a lot of variation within a state as to where those DBPs are practicing. Within the field, there's been a lot of discussion about what do we do to make sure that we are addressing healthcare needs of children in this country, because pediatric population is growing, but the number of DBPs is not increasing at a rate to meet even current healthcare needs, but will not meet them as the pediatric population continues to grow. And in our field, there was a big paper last year that talked about various different ways to try to mitigate this disparity in providers. And they talk about differences in training pathways, differences in clinic models, and differences in policy on a larger scale. And one of the things that they talk about is doing integrated care, which I'll talk about in a little bit more detail, but trying to figure out how to use the DBPs we do have in a more efficient way to provide more care for more children. So traditionally, I think when most of us think about a clinic, we think about there being a type of doctor and they're in a clinic space. And then there's another type of doctor and they're in a different clinic space. And they don't really talk to each other. They're not working together. They're pretty isolated. This type of model over the years has gone under more criticism, and people have tried to think more creatively about how do we make it so that different types of doctors and other healthcare providers are talking more effectively. And so people have started to do various types of integrated care models where people are doing more communication, working more in the same spaces, and trying to make a care plan that's more cohesive, collaborative, and better for patients. And so there's a lot of variety within that, but the mental health field, behavioral health, has used more of these models and has done more in the research and literature space describing these types of models. So they have a framework to think about integrated care. And this table has a lot of information in it, but I wanted you to understand the basics behind this principle, which is that there's a lot of variation in what integrated care means. And it goes from the basic level of kind of that more traditional clinic model where people are on different spaces. They don't really communicate unless they need to in very direct ways. They might just read each other's notes. And then it goes all the way up to a fully integrated model. So it goes from level 1 to level 6. In a fully integrated model, you'd have people in the same clinic space. They're talking to each other about the patient. They're maybe seeing them on the same day. They're making plans together. And there's a lot of variation between that. So it can look very different in the particular environment that you're in, and it varies between less integration and more integration. And we have a few of these types of clinics going on at UC Davis that are at Sac County, and they haven't been described yet in the literature, but I wanted to give you some examples of other descriptions of these types of models in developmental pediatrics specifically. Throughout the country, there's been lots of different ways that this has been implemented. And the general thing that you can take away from reading these various papers is that there's a lot of variation in how they're implemented, but overall it's positive. So people feel like they're able to more effectively access healthcare. There's shorter wait times to get an evaluation. Families and providers feel like things go better. There's more cohesion. It's overall positive. And so my project, as I talked about in the beginning, is trying to describe this topic. So I'm doing something called a scoping review, which is a specific type of review that's a knowledge synthesis, where you're not analyzing data like with a meta-analysis, but it's a systematic review process where you're reading through papers, you're trying to figure out the themes, the outcomes, the descriptive factors that are in papers and describing those so that you have a overall review of a topic that hasn't been well described in the literature, with the idea being that then someone can read that review and get a better understanding of what's been published in the field and what the big themes are in terms of outcomes and things that we need to do further research on. So this has been done in the mental health space in a parallel field, and they have been able to describe some of the things that I want to describe by doing this scoping review, which are what the different practice models look like, the variation within them, the different outcomes, what are some of the areas that they need to do more research on in the future. And so these are the types of things that I'm hoping to address in my scoping review. And so this is my objective, is to identify and describe characteristics of integrated care models and their outcomes for children with neurodevelopmental disabilities in primary care. So in terms of my methods, I'll go over these briefly, but with this type of work, it's all about being systematic and doing things in a very structured way so that you make sure that you're getting all the information. So a lot of this starts out with just reading and then coming up with your inclusion criteria, what types of papers you're trying to find in the literature, and making a search that will grab all the papers you want to read about, but is not too broad that you're reading too many papers that are not related to your topic, but not so specific that you're missing things. So first, JBI, which was formerly the Joanna Briggs Institute, they have a methodology for doing this that I followed and made a protocol and inclusion criteria, and then working with a health sciences librarian to make that search as specific but broad as we need to find papers that will address this question, because this is a specific skill set. And then using specific tools to make sure you're doing everything in a systematic way. There's something called Covidence that helps you with these reviews, where you can go through with your inclusion criteria, read through papers, pull them out and the ones that you want and save them so that you're doing that in a systematic way, and then making sure that you're organized. And then in terms of manuscript preparation, there's something called Prisma, which is an organization that makes methodology and checklists for people to use when they're doing this type of work, and they have one specifically for scoping reviews. So making sure that we're doing everything in a systematic way. And currently I'm at the stage where I have my search and I'm starting to work through the articles and finding the ones that will fit in for this scoping review that I'm doing. And so this will be an ongoing process and a lot of reading for me over the next few years, but then hopefully we'll have a nice finished product that someone could pick up if they wanted to start this type of clinic and have a lot of information about it.
The UC Davis Mind Institute was founded in 1998 with the promise to reduce and prevent the disabilities that can be associated with autism and other neurodevelopmental conditions. Every day, our clinicians and researchers make progress on that promise. Our groundbreaking research on autism, Fragile X syndrome, chromosome 22q11.2 deletion syndrome, ADHD, and other conditions associated with disability are helping affected individuals achieve their fullest potential. Please visit our website or our social media platforms to find out more about current studies, upcoming events, and how you can help make a difference.